Hi, Ariel. I'm Tracy.
Nice to meet you.
I'm here to help you understand how to appropriately empty your colostomy bag as well as remove it and put it back on. You doing okay today?
Yeah, I think so.
If you have any questions, feel free to ask, and we will. I'll try to answer them as well as I can to help you understand. Before I have you actually remove your pouch or put it back on, put a new one back on, I'm gonna get a unused pouch and kind of tell you about the pouch and the system that you have here. Okay. One of the first things I want to talk about is the opening of the pouch, or the tail, when you go to empty your bag. Because your bag with a good seal, you should get up to anywhere from 3 to 5 days, maybe 7 days. So you're going to be emptying it more often than you're going to be changing it. So it's important to know how to do that thoroughly and well, so that you don't have any leakage or have any odor. When you want to empty your bag when it's 1/3 to half full. Don't let it get super full or it'll pull it off and you'll have leaking and stuff. So you this particular system you have uses Velcro for the seals. Sometimes other products use clamps, and if you ever get into one of those and you're using the clamp system, be sure to not throw the clamps away, because you don't get one for each bag. You just wash the one you have and reuse it for a couple of months at least. So when you're going to empty your bag, you're going to open it down at the bottom, and you're going to get it open and hold it over a toilet. You can either lean over a toilet, you can straddle the toilet, and let it empty into the toilet, whatever's comfortable for you, whatever works best for you. So while you're holding it open over the toilet, you're going to press on the bag and push down in a downward motion, expelling all of that stool out. Once you've emptied it, you're going to take some tissue, and this is really important to really clean this area well. This system, I forgot to fold this down. This has a nice Velcro system here where you can fold this tag back so it's out of the way and it stays neater. So anyway, after you've emptied it, you're gonna take some tissue. You're gonna clean the inside rim as well as the outside rim. Bring it closed, wipe it down, get it good and clean. And that's important so that you don't have any problems with odor. And then make sure that you're closing it in the correct way so that you don't have any problems with leaking. And with these, it's nice that after you've got it good and closed, you can tuck that bottom part that little tail right underneath this pouch, and that keeps it out of the way so it doesn't snag on your clothes or get into your crease of your body or anything and irritate your skin. Let's see. So another thing is the barrier that you stick to your skin. So it's got a couple of substances, ingredients in it called polymers and dry tack. And those are the things that help it stick to your body. And having the whole thing well adhered is important to prevent leakage, to be able to get multiple days of wear so you don't have to change it very often. So that's really important. Two of the things that are needed to get a good stick is heat and pressure. The heat warms up the polymers, which causes them to flow into the creases of the skin and contour to the body, so you get a nice complete seal. And the dry tack needs pressure so that it's activated to stick better. And you can remember, dry tack, you need dry skin. So you want to make sure after you've cleaned your skin in the area that you pat dry it it really well so it's good and dry before you apply this onto the skin. And then another thing, when you've taken when you take your pouch off, you're going to look at the back on the barrier, and you're going to look at signs of erosion, which is where this material absorbs moisture and it gets kind of tan and thicker, kind of swells, sort of gooey. That just means it's absorbing more. It could be perspiration, it could be leakage from the stoma. You're also going to look for stool back here, as well as stool on your stoma. That can be signs of what's called pancaking. Pancaking is when the stool can't fall down into the bag because there's a vacuum in it. And so it just stays right on the stoma, and as you keep stooling, it pushes the stool down under the barrier ring, and the barrier ring holds that stoma against the skin. And then you're also looking for signs of leakage. There's just liquid that comes from your stoma under here. All of those things can be irritants to the skin. So it's really important to make sure this is fit well, that your hole is the appropriate size, and that it's well adhered. All right, after talking about the barrier, let's talk a little bit more about your pouch. A couple of things is they come with filters. The filter helps keep your bag from ballooning up from gas. Sometimes the filters are charcoal filters, which also helps with odor. And then I referred earlier about pancaking. That's caused by a vacuum, and sometimes what happens is when you empty your bag, or sometimes when you have a new bag and you're putting it on and you've been pressing on the bag, it creates a static charge which creates the vacuum. So before you close your bag for the final closure, you want to make sure you've put some air in there. You can either open the bottom and sort of push some air in, blow in the bag before you close it, or you can, if that doesn't work, sometimes you can take like a small wad of toilet paper, put it down here in the bottom, and that creates a space of air so it can't stick down. Okay, so do you have any questions about what we just talked about?
Not so far.
Okay, good. So let's go to the actual doing, okay? So we've cut this barrier to the right size for you. One of the things I failed to mention, when you're removing your barrier, the thing to remember is low and slow. You don't want to reach in and just rip it off. You want to, like if this is it, so you're gonna reach right up at the skin, and then with your other hand, pull your skin tight, and then slowly peel it down. And as you've peeled it, keep moving your finger so it's close to the skin, and pull that skin tight and pull it down until you get it all off. And then you need to clean your skin, with a damp cloth, and be sure and pat it dry.
Can I ask, what's the purpose of the will and sew method? What is that?
Oh, that's a good question. Because your skin needs to really hold up, and so you need to be very gentle with the skin surface. If you pull too hard, if you're not careful, you can potentially tear your skin. You can cause it to thin and strip and create open areas, which are painful, and it makes it harder for your apparatus to stay stuck down. And so we're just trying to avoid that altogether. So I'm going to go ahead and have you remove your stone. First I'll have you empty the bag over the toilet, like we talked about.
This is
Okay.
what a toilet is.
Well done.
Okay.
Good job. Very good. Okay, now let's go ahead and remove your appliance. But before you do that, here's the one that you're going to put on. And so you're going to have to be warming up the barrier so that it'll be ready to adhere to your skin.
Mm-hmm.
When you remove that, you're going to be using one hand with a tissue wadded up, held against your stoma to keep the output from flowing. So since you'll be one-handed, like I said, you can either tuck this in your waistband, you can put it under your thigh, in your armpit. This side needs to be against your skin so it's warmed up. Okay. So go ahead and put that where you want it.
I guess right here.
Okay. All right. Now when you remove it, you're going to go low and slow. So you're going to grab right at the top of edge. Okay. And then pull your skin away, keep it tight, and go down. Yes, slowly. Very good, very good. Good, all the way till it's off. Nice. Oh, you have a beautiful stoma there. Just a nice little rosebud flower. So you're going to inspect your ring, your barrier. You're going to look for erosion, stool, or leakage. This one looks really good. You did a really good job of that one. Okay, so you've cleaned your skin, you've dried it really well. You're ready to go. That's okay.
Sorry, my fluids, they're everywhere now.
Well, it's a colostomy, so you stool on you're not stooling continuously, so you can actually probably get away with using two hands most of the time. So you've got that on, you've warmed your ring up, you're ready to put it back on. When you do that, you're going to, remember, fold it back in half and hook the hole in your barrier, the bottom hole, edge of the hole, against the bottom edge of your your stoma, sorry.
Thank you. So kind of like fold it in half here.
Yeah, get it, and then you go ahead and remove your tissue.
Oh, right, yep. Wouldn't want that in the way.
All right.
Sorry.
And just throw that away.
Yeah.
And then make sure you're using your fingers to get it stuck really well around the border of your stoma. Good, good. And then hold some pressure over. Just hold it there for 30 seconds.
Okay.
Okay.
Sing happy birthday.
Right.
Okay.
And then make sure your pouch is closed correctly.
That's embarrassing.
Oh, I'm sorry. Be sure to make sure there's some air in there.
Oh, right. I don't want any pancaking.
No, that's not the way I like my pancakes.
It's a different kind of chocolate.
Right? All right. Good job.
Okay. And then just tuck it up in here.
Mm-hmm.
All right. Neat.
Good job, Ariel. You did fantastic. Are there any questions?
No, thank you for taking the time to explain this all to me.
It's been my pleasure. So please be sure to call me or contact me. You can text me if you have any questions, if we need to meet again, and I'll have any resources you need. Did anyone tell you about the UOAA?
No, what's that?
United Ostomy Association of America. It's a great resource. You go to their website and they have educational resources. They have, they'll help you find support groups that you can be a part of in this area. And it's just a wonderful organization that will help you as you become comfortable with your new normal. So,
Thank you.
all right. Thank you so much.
Nice to meet you.
Nice to meet you. Hi, Rebecca. Sorry, take
Just
two.
go with it. It doesn't matter. It doesn't matter what my name is.
It does. Hey, Rebecca.
Just go with it.
Is that correct?
That's correct.
All right. So before we get to the actual doing, I wanted to tell you. I'm sorry. There's a dog here. Sorry.
No, restart.
I closed it. You can kind of wave some air into the opening. If you find that doesn't help, you can take a wad of toilet paper and put it down into a small wad, down into the bottom of the pouch. That creates a lift of the top from the bottom, creates an air pocket so the stool falls down more easily. Using a hairdryer is a good idea, but it's not. You don't want to get it too hot or cause it to melt. Kitty, stop.